Good afternoon, everyone. We will be beginning our webinar in approximately 1 minute. Thank you for joining us. Good afternoon, everyone, and thank you for joining us today for this webinar on COVID-19 and beyond, 5 key tasks for reopening safely and managing risk. My name is Jack Britton. I'm the editorial director at LP Magazine, and I'll be your moderator today. Reopening our economy safely as part of our recovery from the COVID-19 pandemic has become a global challenge. In this webinar, we will be looking at best practices on how to address some of the specific issues around reopening locations and engaging with fellow employees, customers, and partners. But before we get started, let's review a few quick housekeeping items. We will be recording the webinar for those who weren't able to attend today. We'll also be making this program available as a podcast in the event you would like to review the webinar again, or if you'd like to share the information with your peers and your teams. Others in your organization can register and access the archive webcast for the next several months by accessing losspreventionmedia.com. We also want to let you know that you are eligible for 1 CEU credit towards your recertification for any of those that are LPQ and LPC certified that are on the call today. Everyone listening will be muted, but if you have any questions during the podcast, you can click on the Q&A box at the bottom of your screen to submit your questions. We will try to answer as many of your questions as possible at the end of the presentation. If we're unable to answer your question live, we will be using questions to help get additional answers that we'll post through the losspreventionmedia.com website, through our daily newsletters, and as part of follow-up stories and additional webinars we are working to put together in the days and weeks ahead. We want to keep you all as informed as we can as we continue to navigate through this unprecedented event. We would like to thank our sponsor for today's webinar, Everbridge. Everbridge is a global software company that provides applications to accelerate an organization's response to critical events to help keep people safe and to keep businesses running faster during public safety threats such as active shooter situations, severe weather conditions, pandemics, and critical business events such as IT outages, cyber attacks, and other incidents. Our speaker today is Greg Mama, Director of the Everbridge Center of Excellence. Greg has 25 years of enterprise software experience in professional services, product management, sales, and marketing roles. In his current role at Everbridge, he is responsible for solutions focused on the retail and high-tech industries. We're looking forward to his insights on how to address some of the specific issues around reopening locations as we start to recover from this pandemic. Greg, take it away.
Thank you. Thank you very much, Jack. And good afternoon, everybody. Nice to be here. I appreciate the opportunity to speak with you today. I'm going to take around 35 minutes to talk about some key things that Everbridge is advocating in our situation of reopening the economy. So I'm going to walk through those. I'm going to try and give you some helpful tips and some tasks that you can do for reopening your business as we sort of adjust to this new reality of doing business in a COVID-19 active environment. So let's get going. First, I'd like to take a moment to set the context. I'd like to ask you a question. Was COVID-19 on your radar last year? I would venture a guess that it's not or wasn't. A little more than a year ago, we worked with Forrester. We surveyed about 200 global organizations on critical events that they experienced or been concerned about in the previous 2 years. And, you know, there's 10 things on here, but the thing that's not on here is a pandemic, is COVID. The point is, and I'm sure you guys have all experienced this, few, if any, organizations were thinking about this as one of their top 10 risks a year ago. And yet here we are in the midst of this sort of unprecedented situation. So initially, as an organization, Everbridge focused on virus detection and keeping employees and stakeholders informed and safe. As COVID-19 spread, we all needed to do some specific things to prepare our families and prepare our organizations. And that was really the first state of pandemic response that was supported by Everbridge. What we did was basically release various videos like the ones you see here. We came out with communications templates, COVID-19 specific risk data, like risk factors for particular countries, and guidance for customers. So sort of in that initial phase, when we were all trying to understand what is happening, Everbridge was there supporting our customers with things like this. Now, we've kind of entered a new phase. Now as a society, we're attempting to reopen our global economy. And that's really what this webinar is about today. We're going to look at these 5 things, and I'm going to share our thinking and best practices for how you can do them using Everbridge solutions. We've also begun exploring what business travel is going to be like as we return to work. And I'd like to share some of our latest thinking there too. So why don't we go ahead and get started? Our first task is, it really kind of leaves off where understanding the virus and conducting the furloughs and layoffs ends. You know, the next step is really to keep in touch with those employees. That's a task that employees and stakeholders are going to need to be informed. So whether you've done layoffs, furloughs, or you're simply having people work from home, if you're going to bring these people back into an environment, an office environment or another professional environment, then you're going to need to stay in touch with them. And some of the reasons why will become obvious. Maintaining contact, every organization should do this, but it's a particularly acute problem for businesses that have retail or part-time employees. They're hourly employees, and our customers there tell us that when those employees aren't actively coming to work, obviously it's really difficult to keep in touch with them. It's a data quality issue more than anything. A lot of these employees are sort of transient in nature or part-time, and a lot of companies don't invest the time or money to maintain reliable contact information for those people in the HR database. So we kind of have a perfect storm, right? We've got a situation where you need to be in touch with various employees to tell them what to do or what to think about when coming back to work, but you don't have a good way to reach all of these employees. Well, for our retail customers specifically, I'd posit that you actually do have a good way to solve your contact data problem. And that's your managers, your frontline managers. Those are the people that are interacting with their store employees or location employees on a daily basis. They've got their cell phone numbers. They're probably have traded texts and stuff with them in the past. They have the contact information that's necessary to solve this problem. So how can we take that data and make something useful out of it? We'd like to offer our customers the ability to have a store manager, say, come in and quickly add employee contact information into Everbridge. It requires just a few things. It only requires, really honestly, an employee name, an ID if you have one, and a time zone. That's really all we need to reach out to somebody. And then the delivery method is how we're going to actually reach out to them. So if your managers know the name and phone number and the time zone that they're in, you're going to be able to add a contact to the Everbridge database, and you're going to be able to reach out and communicate with that individual. And that's really that's really one of the benefits you get, right? As a frontline manager, I'm adding these contacts, and now I'm able to communicate with those individuals in a corporate approved way using a standard method where everything is logged. And the real value here, though, is that the corporate entity can take advantage of that to do the same thing. So if your corporate communications or your HR teams want to reach out to employees and address them on specific store openings or come back to work things, they can do that thanks to the managers taking 20 or 30 minutes to add the contact information for the 20 or 30 people they manage into the platform. Now, when you're communicating out, this is what the message might look like to an employee. The system supports multiple languages, so people would typically get this in their local language if you configured it to do that. This is what we call a polling message. It's actually a straightforward and easy way to ask a question. In this case, I'm simply asking, would you be interested in working immediately when COVID-19 restrictions are lifted? So, even if your touch points are pretty basic like that, that's still a way to stay engaged with your employees. And I'm sure you guys can come up with questions and things that the store managers would ask to encourage this engagement while everybody is kind of out of the store, out of the office. So if you have challenges with contacting those laid off or furloughed employees, this is a great way to do it in sort of a grassroots way. You can build an updated contact database fairly quickly that's fairly comprehensive. And that approach might be a little bit unconventional, but we are living in somewhat unconventional times. So it's not necessarily bad to take an unconventional approach. And this approach is also fast, it's easy, and it's secure. So benefits there for you. And the value of this effort is going to become evident as soon as you start trying to reopen stores or reopen offices. It's going to come through staffing. You're going to be able to actually staff those locations more effectively because you've maintained that communication with the employees during this time. Okay, well, let's look at our second task now, providing return to work guidelines to employees. If you've got challenges with your contact information, that first tip will help you with that. Now, what do we want to tell our employees as pertains to maybe coming back to work? What more formal guidance do we want to provide on what's expected of them and what they should do in order to return to work successfully? Well, different industries are going to have different guidelines for this. Obviously, in retail, we've already seen examples of back to work plans from industry trade groups and companies like Kroger. So kudos to those organizations. And I've read through the Kroger guidance and it's quite comprehensive. So some pretty good stuff out there already in the market in terms of guidance for returning to work safely. But if you're unsure what to say to your employees, there's really a couple ways you can handle that. Honestly, it may be a great idea just to check with your industry's trade association. NRF and the Retail Industry Leaders Association came out with guidance for how to reopen, as did Kroger. So those associations can be a good resource for this. Now, Everbridge can obviously help you with this too, and our partners also can help you with the messaging. But at the end of the day, we're going to provide you an ability to deploy whatever that information is down to those employees. Now, the easiest method to push information to employees is to include it as a link or an attachment in an actual message. Now, employees can receive this message however they want to, whatever delivery methods are valid for them. For example, here, the delivery methods for this message are the Everbridge mobile app, SMS, and an email address. So if the employee doesn't have the app, then the message will still go to their SMS and their email address. They're going to get the message regardless. So it's pretty straightforward to identify all the ways you can reach out to somebody and then, of course, use Everbridge to actually do the reaching out. And if you do send an attachment, that's actually going to come through in an email and in the mobile app. It's not going to come through in an SMS because it's an SMS. But just like any other attachment within Everbridge or within your email, you can just tap on it and it'll open it. Typically, that's going to be a PDF or some type of document. Now, a link is another way to send information. And frankly, this is a best practice because you can change the content of the link or at the link at any time. A best practice would really be to issue links to information as opposed to sending an attachment. But either way, we can support you. So if you need to send out a specific document or something like that, absolutely no problem. Another way to have employees get this information is to make it available as a resource in the Everbridge mobile app. You can see my back to work icon here. Customers can come in, they can add their own icons and they can add their own content to the Everbridge mobile app. So you could tell your employees or even train them if they are always checking for updates, they can always check here in the mobile app for the latest information. Instead of pushing a new message to everybody every time you need to communicate, this is going to be more of a pull, right? Users are able to open up the app and tap on the button to receive the information that you want them to receive. And this particular message, this is actually directing the user to go to the Everbridge portal and answer some questions to determine their eligibility to return to work. And that's something else that we can actually do through the Everbridge portal. The idea of this process is if they're approved to go back to work, they can get an SMS authorization that they can actually show to their manager, like, hey, the company says it's fine now for me to return to work, and have that right on my mobile phone. All of this activity, everything's logged. So you can see how and when each employee received the message. And if you asked for them to respond, you can actually see how they responded. So you have very discrete, detailed insight into who responded, how they received the message, how many different ways they received the message, when they responded, essentially all the information that you need to create that audit trail to confirm that you've taken care of communicating the appropriate information to these employees. And whatever your company's company or industry guidelines are for getting back to work, you're going to need to communicate those to your employees. And since employees are going to need to behave differently after COVID-19, this is going to help them learn safe practices that you can standardize on when they come back to the office or come back to the store. All right, let's look at our third task now, performing employee wellness checks. And that's a logical next step, right? This is going to be a critical part of returning to work. You don't want to bring sick people back. So let's look at how you can perform employee wellness checks as people prepare to come back to work. Our customers, you guys, you need to gauge the risk of reopening physical locations. And frankly, the biggest risk for reopening is whether employees who are sick could come in and infect other employees or infect customers. You certainly don't want to open a facility with a sick employee that could get others ill, and you certainly don't want to have a customer encounter that or send a sick employee out to meet a customer and have unfortunate results of that. So this is really, it's just critical to screen and wellness check employees before you bring them back into this environment. It's going to result in a much smoother transition to normal business for you guys. So let's look at how you can start checking on that right now with Everbridge. You guys have already seen contact information. I talked about this a little bit, you know, the person's information as well as the modalities or delivery methods where we can reach them. That's obviously critical information for keeping anybody informed. But there's also another dimension to this that we haven't discussed yet. So let's discuss that now. I'm talking about location. The location of these people can actually be critical to the message and the information that you send to them. Where people are is important for wellness checks. Employees in one country might be experiencing a different phase of the virus than in your country. So rules about going back to work can vary, and they can literally vary down to the local level. A country, a state or province, and even a local jurisdiction can issue guidance. So knowing where people are is important if you want to send them relevant and correct information. Now, we have several ways to do that at Everbridge. If I happen to be a traveler, again, not a whole lot of people traveling yet, but this is going to change soon. I have a travel itinerary, and that shows where I am now. It actually also shows where I was yesterday, typically, and where I will go during the duration of my trip. So that's really valuable information to have about an individual. If I'm a lone worker, I can share my real-time location using the mobile app. So, maybe if I head into an area that's a hot spot or an area where there are power issues or something like that, a lone worker can actually become aware of those situations. And if I work in an office, communications to that particular office should include me, including guidance for how to come back to work and how to do a wellness check. So the point here is that the messages I receive to do my wellness checks, it can depend, and it can be based on a variety of factors, including where I am, where I was, or where I will be in the near future. So the way this works, as for the message itself, we're going to use another polling message, and we're going to ask people to answer our question in one of these 6 ways. And that enables people to respond, with a specific answer so that you can then further classify or categorize them into groups. When we send the message, it's going to be delivered to your contacts based on their location, their job role or team role, and many other factors that you can take into account. So we want to make sure we're giving this information to the right people. We don't want to over notify, but we also don't want to under notify. And the idea here is to be able to reach as many as possible and give them the right tools and the ability to answer the question that you have for them. And that's what they're going to do next for you. They're going to respond, and you can see when and how each employee receives the message and how they respond. For example, you can see that my colleague Vince and I both responded to this message, and you can see that I responded via an email address. There's my confirmation there. And Vince actually responded through the Everbridge mobile app. So you're able to, down to the 10th of a second or 100th of a second, actually know when something has happened. So based on guidance from CDC, World Health Organization, perhaps your own industry expertise, you can then further tell people what to do based on their answers and based on their category. The sort of the net result of this is those who tested positive for antibodies, maybe they answered that, they can probably be allowed back into the workplace, while those who are having symptoms or are considered higher risk, those folks can continue to work from home. And you do need to develop appropriate messaging for both of those situations. You know, it's not the person's fault that they're sick, right? So you can't come down on them. You want to provide them with something helpful that basically says, hey, based on your situation, we don't think it's a good idea for you to come back yet, but if you have questions, please let us know and we can talk to you more about it. And that's really the idea there, is to give the employees that comfort as part of the wellness check, that if they have questions, you can help. So wellness checks going to help you improve planning for staff to return to work. Specifically, we're going to do that by giving you detailed insight into employee health. You can also keep your obligations to employees to help them stay healthy and keep your operations active. Now, obviously, nobody wants to get a customer sick either. So, you know, the objective with wellness checks is to make sure that you minimize or prevent sick people from entering the environment and spreading the disease. But inevitably, that's probably going to happen to most of us at one point or another. You've stayed in touch with your employees, you've done your wellness checks, some of your locations are now starting to open back up. Unfortunately, the virus has a long incubation period, and really, I have to say that I expect that we're going to see, see the virus spread again as people go back to work. So let's look at what you can do to manage that risk when an employee has symptoms or reports that they're sick. There are really three things that you need to manage this situation. The first is an ability to report the suspected illness. That's for the person who's sick or the person's manager to actually speak up. We've seen several strategies for this, including employee self-reporting, surveys, temperature checks, and some folks have even gone so far as to get thermal imaging cameras to look for people with fevers. The second thing you need is a process for evaluating the employee's health. So you're suspicious the employee might be ill, now you need a process. And that process, honestly, is going to vary based on where the employee is and what they do. So we may not be able to define that process here today, but you would be able to do that in your organization. A supervisor could then take an employee through questions and a temperature check to perform that evaluation. You can even use telemedicine if you had that service available. The third thing you need is a process to mitigate the risk. And this is probably the thing that gives people the most confidence. If the employee does meet the criteria for having COVID, you're going to want to take action on behalf of that person and on behalf of the other employees and people in that space to make sure that the virus stops there. So let's look at reporting first. This is how you could potentially report. One way is to use the Everbridge mobile app. An employee can use the app to self-report, or a manager can report a sick employee. It all uses the same mobile app. It just depends on what your rights are in that app and what you can do. They can select that COVID-19 category as part of their messaging, so that message will be categorized when it reaches Everbridge, and you will know what to do with it. You can also include pictures, a geotag, whatever makes sense for this particular situation. Now, when they report, a message is sent back to headquarters. It's sent to stakeholders, and a workflow from that point on can be triggered, a workflow to respond to the employee being ill. Everbridge, by the way, we understand that some of this information may reach into protected information or PII or otherwise protected information. And we want you to know that that's important to us too. We're very serious about security. We use modern encryption. We use all kinds of stuff for that. Now, another way to report is through IoT integration. Suppose you're using a digital thermometer or a thermal camera. If one of those systems identifies a person with a fever, it can actually reach out and notify Everbridge. A notification from the thermometer can trigger additional actions. You can set up an evaluation workflow and deploy it to your managers so that every employee who is reported as sick is evaluated consistently. They all need to be evaluated the same way. For example, a moment ago, we responded to the fever question, and I'm going to mark that task as needs attention and add a comment since the employee had a fever of 101.5. Now, everything that everybody does is logged, so you're going to have an audit trail. You're actually going to have a log of what happened, and this is just an example for how that looks in this task list. We have complete audit trails too, so you can see what every individual did as part of this. So when I put in that needs attention mark, that's visible to the organization and that's going to trigger additional workflows. That's going to let other people know that they need to do things. In case of our person with the 101.5 fever, I might have several things happen automatically. Maybe I want to request a COVID-19 test from the EHS team or the global security team. If I have a telemedicine service on call, maybe I want to do an instant appointment with the doctor and have an evaluation done right there. And I could also, of course, let HR and facilities know that a person is being tested. So if the test is positive, those two groups can immediately start to take action. For example, facilities can start to disinfect the area where the person was. So the idea here is to orchestrate that response and make sure that everybody knows what they need to do for the day to proceed on safely. So that puts us back in a mitigation territory. Now you need to mitigate the risk. Mitigation is going to depend on the situation. I know that kind of sounds like a cop-out on our part, but it's really not. I wouldn't dare to tell you how to manage your facility, right? I'm not going to come into your facility and tell you that these are the things you need to do. So what we offer is the ability to give whoever needs to do this mitigation three very important capabilities. They need to be able to communicate both with you and maybe with other stakeholders. They need to know what to do. You need to give them specific instruction, and they need to be able to ask for help if they don't understand or if there's something about the situation that, that requires assistance. So that's going to be key for mitigating the risk to your employees. So let's take this to a logical conclusion. The employee, unfortunately, has tested positive. So we have an issue now, and the logical conclusion is the next step is probably going to be for the office manager to arrange for the infected, the employee in that workspace to be removed, of course, and then the space to be cleaned. The CDC provides those guidelines. Certainly you can offer the website up if you want to. You can deploy this also through a mobile application. So as an office manager, you can follow along with these procedures. You know, you've got your task list on the left and your just basically web content on the right. We can push either one of those out to individual users, but personally, I'd prefer the task list because this is trackable and auditable. And as people are performing these steps, you're able to see and know that. So certainly either one may work depending on the situation, but if you want to have that audit trail, then certainly using a task list is probably the most important or the most appropriate way. So now you're open, you're keeping your employees informed and safe, and you have reached a place where it's time to allow visitors back into your facilities. So let's look at some ways that you can manage visitor access safely. There are several ways to actually start the process of being a visitor. You can be pre-registered for a visit through a visitor management system. That's the most formal method, and frankly, that's a best practice. We would encourage everyone, particularly with an office environment, to have any visitor pre-register. That was really a best practice even before COVID, and I think COVID just illustrates the importance of knowing who is coming into your facilities. There are other types too. You can be invited to visit, but without a formal registration process. Somebody can make an appointment with you and just say, yeah, I'll meet you in the lobby at 9. People that are responding to this usually just walk up to the security desk and ask for the person who invited them. And then sometimes you might have an unexpected visitor, or maybe your business model is such that you serve walk-in customers, or you have customers coming in and out of your facility on a regular basis. So these are different ways that visitors can come to your attention. But regardless of how they came to your attention, you're going to want to screen them all for COVID-19 symptoms before you let them into the facility, before you expose them to other people. So suppose you're headquartered in a large building and you have Envoy as your visitor management system. You require guests to register. All guests, including your walk-ins, must answer screening questions when they check in, like these that I just grabbed from the American Healthcare Association. It's a simple screening list. But what happens if a guest exhibits symptoms like an elevated temperature or their answers to screening questions cause concern? Well, the front desk employee can start and manage a visitor evaluation workflow with Everbridge mobile or web applications. This workflow can involve many different steps and people. Each one can receive their own specific information and their own specific instructions. If you put those screening questions in Envoy itself, or another visitor management system, and those visitors' answers cause concern, Envoy can actually trigger the same process automatically. So a person doesn't even have to do this, if someone answers the screening questions in a way that causes concern. Here, what we're doing is both solutions are sending out a screener request and setting up a conference bridge. So if the screen comes back positive, probably the next action is going to be a quick conference call to determine how to best manage the situation going forward. So that's what our message is doing there. And you guys saw this when we talked about employees getting sick. The person doing secondary screening can receive a task list of instructions for evaluating the person. And if the visitor fails additional screening, just like an employee who may be sick, you should not let them into the building. So as part of this process, again, I want to mention PII or medical information may be collected. And again, I want to say that your data is encrypted and secure at every step from the mobile app on through our cloud architecture. So we comply with a whole bunch of different security standards that we're happy to share more information about if you're interested in knowing. Okay, so we'd like to help you improve your ability to manage visitors, and we think there's 3 important ways that we can help you improve. First, we're giving your frontline staff a process and confidence. We want to give them something that's easy to do and is designed to minimize their risk. And this makes them more capable and more confident of doing their job. Second, you're evaluating visitors consistently across the organization, whether they pre-register, have appointments, or they walk in. Again, I'll go back to this. Consistency in the visitor screening process is necessary. It's just going to simply be required to protect your organization. And last, you're doing your part by preventing the spread. You don't want to, no one wants to be passing this around, right? It's not something that you want to be known for having that happen. So, do the best that you can to manage your visitor integrity and your visitor security so that you're detecting people who may be ill and weeding them out before they have a chance to cause additional infection. I got a little bit of time left. I promised a bonus, and since I'm a pretty fast talker, I think I can do this, and we still have plenty of time for questions. There's not a lot of business travel taking place yet, but as we reopen the economy, we're all going to be faced with this. I'm going to be faced with it, and I imagine many of you are as well. So if you have anything to do with traveler safety, traveler security, definitely managing that in the COVID-19 world should be on your radar. Now, one of the first things you need is to know the traveler's location. Honestly, that's just a requirement if you're going to manage their risk effectively. So to support that, we work with partners like International SOS, Concur, Magnatech. The idea here being that we can take that PNR data, the traveler itinerary, and actually use it to locate the individual. Now, if the individual is carrying our mobile app and sharing their location, then we can also know where they are based on the last reported location from the mobile app. So this is all standard stuff, right? You're probably familiar with this from Everbridge and other solution providers. But where things start to differ is in terms of risk intelligence. In today's environment, the challenge is cross-referencing those locations based on their itinerary or based on their real location with the mobile app. The challenge is cross-referencing that with risk information. You need to be able to provide travel risk information to the traveler. You need to understand what's happening at the destination. Will the traveler be subject to any additional regulations? Do they have to wear a mask? These are all straightforward questions that need to be answered as people are going to be traveling and visiting the world in the COVID-19 world, I should say. We know what's impacting travel. We know what's happening at the traveler's destination, and certainly we can help our customers do the same. We've also recently added the ability for organizations to create their own risk ratings. So customers asked for this because often a traveler's risk can be very specific to the business that they're in or the location where they're going to be. If you're traveling to evaluate a textile factory, that's one thing. If you're traveling to look at oil drilling, that's a completely different thing. And each one of those things has their own risks. So our customers want the ability to create those ratings on their own. And once they do that, then they can provide even more detailed guidance internally to their people regarding risks to travelers or really risk to operations in any particular country. This protection extends real time. Suppose we have a traveler who lands in Singapore, and while he was in transit, Singapore issued an alert about COVID-19 that may be important to him. I would argue this one probably isn't too important. It's simply an updated tally for Singapore. But what if there was something else issued, like a mandatory requirement to wear a mask or something like that? Well, with Everbridge, we'll pick up on that information, and we can actually let the traveler know when they land about this particular situation. So because of their itinerary or because of the mobile app, we know where they are, and we're able to actually address them that way. Now remember our risk mitigation triangle and the things employees want to have. Travelers want exactly the same thing. They want to be able to communicate. They want to know what to do. Uh-oh. Lost a button click there for a minute. They want to be able to communicate, know what to do, and ask for help. I think that's relatively clear today. And a traveler who's linked back to the organization, they're going to be a happy traveler. If they have that two-way communication with you, if you're keeping them aware of the things that are potentially risky, and they're keeping you aware of their location and their status, that's a positive thing. That's a good thing to have in your organization. Okay, well, let's do a quick recap. I've also got some helpful 2-minute videos for you guys to show the highlights of each of our 5 tasks. So you're going to see links here, and certainly welcome to visit YouTube and click on these links and see what you can see. First, we talked about how to keep in contact with employees, particularly folks who might be furloughed or laid off. And we looked at some ways to provide return to work guidelines so employees know what to do. And we talked about doing employee wellness checks so you can determine when employees can actually come back to work. We looked at what to do in the pretty much, unfortunately, inevitable situation that an employee in the workplace gets sick, and we rounded things out with managing visitor access. And of course, I get the bonus topic too, traveler safety. I don't have a video for that yet, but I think you're going to see a lot out of Everbridge in the coming weeks on how to manage traveler safety effectively in this COVID-19 world. So if you're wondering what to do next, I'd recommend that you watch those videos, of course, if there's a topic of interest to you, but just as much or more, I'd like to recommend that you attend our upcoming virtual symposium. This is next week, and it's about COVID-19 and the road to recovery. This is free, and we have, frankly, 2 amazing speakers, as well as a variety of other speakers. Colin Powell and Dr. Scott Gottlieb are going to speak. So I think that's, I definitely want to hear what they have to say, and I imagine some of you do as well. So I'd encourage you to go register for that. It's completely free. There's a variety of other speakers and an agenda that you'll get upon registration. So if you're interested, by all means, you can hear from some real leaders about what their thoughts are on continuing life in the COVID-19 world. And that's it. I want to thank you guys very much for listening. I appreciate your 35 minutes of time here, and I'm happy to answer questions if any questions are out there.
Thank you, Greg. Terrific. Before we begin the Q&A, I want to remind you that this webinar will be available on demand for the next 90 days. You will be getting an email reminder with a link to the presentation. There will also be a link on the webinar page of the magazine website at losspreventionmedia.com. Now, our first question is, do you have contact tracing?
Ooh, great question. We've all been hearing a ton about contact tracing. So I think there's really a three-part answer to this. We do have some contact tracing functionality today. However, getting that out of the system can be more of a manual effort than we would like it to be. So we're actually working on a full contact tracing solution. We have a minimum viable product scheduled for next month, actually. We're focusing on citizens first, then healthcare, and then other corporate clients, because that's where the need seems to be greatest. We obviously can reprioritize if it matters, but we're really looking at how to make sure that every citizen is aware of what their potential risk is, and that's really our first priority. So we have some of the elements of contact tracing now, and we have more coming in the next 30 to 60 days.
Greg, for those that don't understand, what exactly is contact tracing?
Well, I've heard a lot of definitions of contact tracing, but I'm going to tell you what I think it is. It's essentially being aware that you've come into contact with someone who has the virus or later tested out to have the virus. So you get your device, you can register on the device that you have been ill with COVID-19 and tested for antibodies or a variety of other things. And then contact tracing is actually the method of going back through all the places you've been. And there's a lot of talk about using Bluetooth technology to identify the phones that you've been close to. And if you happen to have been close to someone's phone who has COVID-19, then you're considered an elevated risk at that point. So there are a bazillion definitions of contact tracing floating around, but essentially it means being aware of when you've been in contact with someone who has COVID or was later determined to have COVID. Sorry for the long-winded answer, but it's an interesting
good answer. Okay, do you offer consulting services for helping companies open up their facilities after COVID-19?
Well, I think we could, but we'd really want to talk more about what you want to do. If you're in this situation where you're struggling with what to say, we've got several partners that are all in on the messaging and how to successfully bring people back to work. One I'll mention is Control Risks. They are really good for that, and they also have a lot of familiarity with our technology, so they can certainly help in a situation like this. I guess the answer there is maybe, but it's likely if you're looking for guidance on what to tell employees or things like that, we'd probably refer you out to a partner. We're a technology company, so we don't want to step outside of our box unless we need to.
Okay. Can you integrate with Workday to get employee data?
Oh yeah, absolutely. Workday is probably the most common HR system that we integrate with. There's a multitude of ways. I can use secure FTP and literally just download a file securely on a nightly basis or whenever I want. I can do a real-time API call. So if someone's terminated and you want to make sure they're removed from the contact database that instant, then we can use the API to do that, or to add a new employee right at that time. So there's a lot of ways to integrate with Workday. I see a comment in here that made me laugh. Thanks, Rick. I appreciate that. Anyway, so yeah, we can certainly integrate with Workday, but we can integrate with most of the HRIS out there. I mean, it's all of them have the ability to do some type of export, or they have secure APIs, and we can leverage either of those to integrate.
Okay, we use American Express Travel. Can you work with them?
Yes. We don't have a direct relationship with Amex. We actually have a relationship with a company called Magnatech, and they provide connectivity for Amex and I think 12 or 13 other major booking companies as well. So we can get the PNR data, the traveler itineraries from Amex through Magnatech, or we can get them from Concur. There's a variety of different ways we can actually bring that data in. And of course, the mobile app will tell you where people are in real time too. As long as they're sharing their location, you can actually see that.
How have you seen your customers approach their employees to provide their personal contact devices into a corporate system, given that not all employees have corporate issued devices?
So I'm going to presume personal contact devices is actually personal contact information, but that may not be true, Daniel. So I don't want to misinterpret your question. If it's a question about using BYOD with our solutions, with the Everbridge mobile app, then yes, absolutely, that's something we can do, whether the device is corporate owned or not. I think that the situation that people run into is if the device is corporate owned, the corporate entity should ultimately control what gets installed on that device. So, the company can tell you have to install the Everbridge mobile app, and if they own the device, they can tell you have to enable location services. Now, I'm making a big generalization there, right? The laws on that obviously are going to vary based on where you are, but I'm not sure, Daniel, if I'm answering your question or not, frankly, but if you want to talk about that in more detail, by all means, please reach out to me and I can try to do a better job for that.
Okay, and we have one from Rick. Are you tracking cases of COVID in specific areas?
Oh yes, we're actually tracking COVID globally. We're using a combination of data from different scientific sources like the Johns Hopkins data and our own intelligence that we're gathering at the local down, or I should say up to the national and international level. So when you say a specific area, if you had one in mind, I'm happy to talk about our coverage in that specific area, but our effort is truly global. We have statistics for every country in the world, and in the United States, I think we've actually got it down to the county now. So we have some pretty good data on COVID pretty much anywhere you want to look in the world.
Okay, Greg, if folks have specific questions that they weren't able to ask today, is there a place where they can contact you, reach you for answers to other questions that they might have?
Gosh, I should have put my email address on here. Let me go back to the title slide. It's my name, greg.mumma@everbridge.com, and I'll show you the title slide again so you guys can see how to spell that. So it's just greg.mumma@everbridge.com.
Okay, great. That's all the time we have for today's Q&A. If we haven't answered your question, we will be using the submitted questions to help put out some follow-up information in the next few days. We would like to thank everyone for attending today's webinar. And we would like to again thank our speaker today, Greg Mumma, and to our sponsor, Everbridge.
Thank you.
To everyone out there listening, we appreciate your time. Stay safe. Have a great day. Thank you.